Hey, it's Dr. Wonder. Hopefully you can see what I'm trying to do here. There should be a lab report up, and I'm trying to make sure that the person's name doesn't show up. What I want to go over today is, let me move this out of the way, just in case I'm doing it right. The reference intervals on a blood lab report. On the right-hand side, you'll see reference interval. And it's big, you'll see the low amount and you'll see the high amount. And what most people are told, or what most people think, is that these are normal values. These are not normal values. And the reason I'm doing this video today is I've done about 10 consultations so far this week. And 8 of them, when I asked them what was on my webinar that kind of resonated with them, that made them want to see if we would be able to take their case, 8 of them so far, today I believe is Wednesday, 8 of them said what I said about what I'm going to be going over on this video, which is normal values versus average values in the reference interval. So hopefully you can see my screen. So these, you'll see the screen here, and you'll see on the right-hand side, where hopefully you see me moving my mouse, you'll see reference interval. These are averages, and these averages are geographic and lab consistent. What does that mean? It means these averages depend on where you live and which lab do you go to. And so if you lived in California and you go to LabCorp, these numbers are different if you live in California and you go to Quest, or you go to Kaiser, or you go to the hospital, or you go to whatever lab. So they're different. If you go to LabCorp in LabCorp in California and LabCorp in Tennessee, these numbers are different. Why? Because they're averages. They are not the normals. What they just do is they take a population study of 2 or 3 years, I'm not sure the exact time, and they plug them in and they say, hey, 95% of people fit between this low and this high. And so we're going to say that is the interval. But most people think or are told that's the normal, and they are not the normals. They are the reference averages. It's very important to keep that in mind. You could be hypothyroid in California and normal in Tennessee, based on the lab you go to and based on which state you are. So it's very important to know that we're not looking at where you are in that reference interval. We're looking at, as functional medicine practitioners, we're looking at how are you functioning. What does that mean? It means I don't care where you live and I don't care which lab you go to. I'm going by a certain set of numbers that tells me, which is much tighter, that if you're higher than that or lower than that, your body is not functioning properly. When you already see a high or a low, like look at this one, you'll see 2 highs. This means that this person is past is worse than 95% of the people. And really it's 2.5%, because it's 2.5% high and 2.5% low, which means that basically the person's almost going to be told that they might have some form of disease or pathology, because when it finally shows up as low or high on a lab report, it's already a big problem. Versus what we're looking at is it functionally a problem? So for this particular patient, these are 2 liver enzymes, AST and ALT, and it's showing 0 to 40 and 0 to 44. The functional norm is 12 to 26. Okay, so that's a big difference when you're looking at labs. That's today's video. All right.